Thank you very much, Lydia. So, continuing with the theme of the Academy, the Academy has just shown such unwavering support, not least by, of course, awarding Lydia a fellowship, but also in their support of the Safer Air Project and the Indoor Air Quality Call in Australia. By travelling to New York, our next speaker helped to amplify the voices of the indoor air quality scientists and community here at home. So it's therefore an absolute honour and delight to have Anna Maria Arabia, Chief Executive of the Australian Academy of Science, to come to speak to us. Anna is called on as an agent of change globally, but she also reforms policy here at home, leading and communicating science to the highest levels of Australian government. Her work has strengthened evidence-based informed decision-making in both parliaments and the justice systems. Anna Maria was awarded a Medal of the Order of Australia for her services to science, and also honoured as a Knight of the Order of the Star of Italy for her commitment to science in society and ensuring its diverse communities can both access and contribute to it. Today marks a milestone that we've heard about for science, for safer air, for the Academy and for Australia. Many in this room, including Era, had the privilege of reviewing a draft report earlier this year. And I think it's fair to say that everybody's been holding their breath ever since. So I ask you all to hold a breath of appreciation as we hear from Anna Maria on the report on indoor air, the science of indoor air and pathways to improve indoor air quality in Australia, and hear how we can use that to move indoor air quality into action.
Thank you, Claire, for that lovely introduction. Could I acknowledge that we're on Ngunnawal country and pay my respects to their elders past, present and emerging, and acknowledge the First Nations people in the room with us today. Thank you, Claire. Thank you, Plum. Thank you, Lydia, who won the Prime Minister's Science Prize on Monday. How good is that? We are so pleased to be able to support this conference and delighted to release our long-awaited report on turning science into policy. And this is such a sweet spot for the Australian Academy of Science, where we bring evidence to decision-making and turn the extraordinary work and research of our fellows, Lydia and others included, into meaningful information that can help drive change and drive policy decisions in places like this, but not only. Wherever decisions are made, we feel strongly about bringing evidence to those decisions. Someone's done that already. Thank you. So why did we do this report, aside from wanting to bring evidence to decision makers? It seemed so obvious when there was and is an overwhelming amount of research around indoor air quality and what we need, as well as the technology needed to address it. What are the barriers? How do we go? What do I tell a policymaker who says, so what can I do? Great, you've got all the science. Great, you've got all the technological solutions. What can I do? So it was our hope to write a report that left no policymaker with any doubt as to what steps they could take. And there unravelled a range of investigations into what is actually quite a complex policy environment that clean indoor air operates in. So our report, which you can download there, is available on our website. Share it far and wide. We'd love to hear your thoughts on it. And I'd like to thank Assistant Minister White. I know she's not in the room, for launching it this morning. We're delighted that it has received attention from the government. It has two parts. So the first part is a science explainer. So anyone who's looking at indoor air quality for the first time can read the report and feel they have a thorough understanding of the issue. And the second part is around the policy pathways we need to activate to bring about action. So there we are. So as I said, the Academy absolutely strives to bring actionable science to decision makers. And when we looked at this, as I said, it was a rather complex area. To pull together this report, we convene our fellows, but I'd also really like to acknowledge the important role that staff members play at the Australian Academy of Science. They're absolute experts at the science policy interface, and I'd like to shout out especially Alex Lucchetti. So you need to give everybody a wave, Alex. She held the pen on this report, and it's hard to overestimate the difficulties in bringing together an extraordinary range of multidisciplinary research from a huge range of people and synthesising that with accuracy in a way that is really understandable and accessible. It's quite a skill. Alex has it in spades, so does the whole policy team. Some of them are here today, so a shout out and thank you to all of them. The challenges, what did we find? So firstly, there is a huge dispersion of responsibility and authority across levels of government and across different portfolios. We absolutely know that a multidisciplinary expertise is required. So when you look at the science of indoor air quality, Lydia mentioned it as well, it covers really almost every discipline. It's also multidimensional, and by that I mean we're not just assessing infectious disease and particles that are airborne. We're also looking at pollutants. We're also looking at pollution more generally. And so it really covers a range of different dimensions. And then it covers another series of dimensions which go to the diversity in public buildings and things like balancing energy efficiency and clean indoor air, balancing thermal comfort so people feeling comfortable and able to work in a workplace, and affordability, of course, because if something is out of reach of any workplace or builder or operator or individual, it won't be implemented. So all of those factors are really, really important. And they are challenges for this space and they're challenges for policymakers. Some of the gaps we found go to the limited amount of knowledge available about indoor air quality across buildings in Australia. We're very lucky that we do have some knowledge now, which has been brought together by the report Lydia presented earlier. But that report also showed that there are data gaps. Certainly published information about indoor air quality in public buildings is quite limited. There's not hundreds of documents published or journal articles published in this area. We know that the knowledge that is available identifies indoor air quality issues across a range of different environments as well. And we know an existing gap is that there are no enforceable performance standards where we are continually monitoring indoor air quality to collect the data that we need. And there's also no agreed approach on how to establish continuous indoor air quality monitoring infrastructure. So with that context, from a policy perspective, we did an analysis of all of the possible policy pathways and areas where we might be able to intersect to bring about change. And I think the number of dot points on this slide probably says it all. The sort of areas of legislation or regulation or policy pathways cover everything from construction codes right through to rating schemes like neighbours, disability discrimination laws, outdoor air quality regulation because it needs to intersect there. The National Clean Air Agreement is another opportunity, tobacco controls, science advice and funding, international commitments that exist that may not have been translated to an Australian setting, combustion associated with cooking, for example, and all the sort of regulations that exist there. And of course, the workplace health and safety framework, which is a really important policy framework for us. And then there is a whole gamut of regulation and law that exists in the healthcare setting. So things like infection prevention and control guidelines, the work of the National Health and Medical Research Council in approving and having those guidelines implemented. The policy landscape is complex. The good news there is that if any policymaker says, what can I do? Well, we have a thing for them. So everyone needs to be involved. So that's certainly a challenge, but an opportunity. As I said, there's no agreed approach on how to establish continuous indoor air quality monitoring infrastructure. How do we actually get the infrastructure into buildings to measure and gather data so that we can act on that data? None of the existing mechanisms on their own are sufficient to move the dial on this one. but they're all necessary and there will be implications across them. So we identified 8 different policy pathways. I'm going to go through each of these in the next slides, just to say that it is the way we have tried to, I guess, put a boundary around this is that we have focused on the federal government, we're focused on public buildings, and it's important to say that the pathways listed here and the elaboration of them, which I'll share in just a moment, can and must be pursued concurrently. So we don't need a sequential approach to this, which would take a very, very long time. There are a lot of things that can be done concurrently. So I'll go through each of these. So the first one is fostering national leadership and coordination. Leadership's important. Having somebody with a responsibility for managing this cross-portfolio issue in the form of a minister or an assistant minister, we think is essential. So we've recommended that the Australian government elevate indoor air quality as a national health and infrastructure priority by appointing a minister or giving responsibility to an existing minister to champion and coordinate policy across portfolios. It really does take that multidisciplinary and multi-portfolio approach. That minister or champion be supported by a multidisciplinary task force that's needed to give the expert advice in parallel so that we're not making trade-offs that are not needed. So when they're receiving advice on energy efficiency in buildings, we're not relinquishing the objectives we have with indoor air quality, and we're able to have all of those people in the same room together with engineers and infectious control people. So there can be a very balanced approach to actions that are taken. And that was a similar recommendation that we made to the long COVID inquiry some time ago. So that covers the first 2 of the pathways, leadership and coordination. Evidence-based decision-making, I would say that, but of course it's absolutely important. The task force can illuminate the science and bring the known and understood science to the table, but there is some evidence that needs to be gathered. So this includes new economic analysis that's needed. The last time economic analysis was undertaken, it was 1998 by the CSIRO. We already know how much that costs Australia. Since then, that will have multiplied significantly. So I think some of that new economic analysis and that evidence will be important to establish. Large-scale implementation of feasibility projects. There are some examples of that through pilots done in the states and territories. There's an aged care pilot in Victoria, for example, and some schools pilots. But getting that sort of data to bring that evidence to the table to supplement scientific and technological data that we already have is important. And any data we're able to then capture on implementation. So that would come from pilot studies and others. But gathering that evidence base is important to add to what we already know. Fourth policy pathway, health-based guidelines. So the World Health Organization Global Air Quality Guidelines exist and they should be endorsed as Australian guidelines with the addition of any clauses that would be required to make them relevant to the Australian context. This is a very clear policy pathway that can be pursued immediately. The organisations or policy people that would be involved here include nHealth in the Department of Health and Ageing, the National Health and Medical Research Council, also linked to the Department of Health, and their work can be leveraged. So the NHMRC in particular has a role in taking guidelines and ensuring that they're implemented. So, you know, guidelines for the treatment of stroke in hospitals or guidelines for, there's a range of different ones that are based on evidence. The NHMRC formally publishes those. So they have a role in bringing about the Australian version of the WHO Global Air Quality Guidelines. If adopted, these sort of benchmarks can absolutely inform the standards that we need, public health interventions, workplace health and safety frameworks and regulation, and risk communication, which is a really important one. So some low-hanging fruit there from a policy perspective. In terms of in terms of managing indoor air quality and enabling enforceable performance standards with continuous monitoring, there are 3 key things that need to be addressed from a policy perspective: building standards, workplace health and safety regulation and standards, and accessibility standards. So as you can see, there's a lot of parallel policy pathways that are required. Again, these frameworks exist. It's not like we don't have building standards, they exist. It's not like we don't have a workplace health and safety framework. It exists. There are model codes of practice that stem from it and that are held at a national level but implemented at a state and territory level. These are policy pathways that could be activated now. Lydia mentioned this, but it's worth repeating. We recommend a 3-phased approach to clean indoor air in workplaces. The first is monitoring with no reporting requirements. So that means the infrastructure needs to be in there. Then measuring and reporting against a standard. And then, the utopia where we really want to get to, the legislated indoor air quality standards for all public buildings. And they become enforceable at that point. I've grouped the other policy pathways together on this slide. But really just to say there are a range of other levers that we can pull, and I think that the nature of the information on this slide illustrates that. So things like the National Environment Protection Measure, applying that to indoor air is another opportunity. This is a regulatory instrument and it's designed to manage and improve the environment by setting consistent national standards and goals. So that could be applied to indoor air quality quite easily. The National Clean Air Agreement exists. That could be elaborated as well. It includes pollution reduction standards. It applies to government and industries, so it wouldn't be a fast step forward to enhance that. And there are a range of existing certification schemes. You might be familiar with NABERS. You might be familiar with some of the indoor air quality product safety and performance standards that go to that are associated with that certification and labelling schemes. And then the last dot point's a really, really important one that I'd like to highlight. All of the work that science enables and that policy implementation enables requires an interface with society. If we don't bridge science and society, we've lost the battle. And so we highly and strongly recommend a national public education campaign to build community awareness, to build community confidence and understanding of why these measures are important, and to build government awareness as well. And to instill a sense of urgency. We've heard today how life-changing it would be if today we could measure and monitor indoor air quality, reduce the transmission of disease, improve people's health and well-being, provide accessibility to those who are currently limited from everyday things that many of us enjoy. These could be quite quickly solved. An education campaign, both for government and for the public, are really critical to achieving that. I know when the Academy started its advocacy in this space, and it was several years ago, I think in 2023, I admit to not knowing a lot about indoor air quality. But it's one of those areas that once you learn, once you see it, you can't unsee it. You scratch your head like, why haven't we done this already? And the more people we speak with, whether that's globally as we did in New York or across this parliament, there is a greater understanding of this is really low-hanging fruit. This is something we could do to complete our approach to public health. It's the missing link in our public health framework, and we need to move quickly to do it. It may take some years to implement, but there's nothing preventing us from starting now. We have the science, we have the technology, and this report shows that we've got the policy pathways that can be activated concurrently as well. Thank you. In closing, I would also like to again thank Professor Marasca. Lydia, thank you for everything, and all of the other experts who contributed to this report. Again, Alex, for your work in the policy team, and to the Safer Air Project for their support in allowing us to launch our report at this conference. Thank you.